Hey, everybody. It is the 20th of December. Last update I sent out was about 2 months ago. And a lot has happened since then. I've just been pretty busy to do an adequate update, but here it goes. Since you last heard, me and Ariel and I had an engagement party with the family. All the Israeli relatives and my father and stepmother were able to make it from the States, and it was nice on a hotel on the beach. It was really fun, and I have some pictures posted below for you to see. Since then, I finished my internal medicine rotation. That finished at the end of November. Internal medicine is a very it's a thinking career. It's all about diagnosing and adequate treatment. It's interesting. I really enjoyed it. I don't know if it's for me or not. So far it's up there on the list, but I'm not sure if it's for me. We'll see as I go through the other rotations. I did an I did an ER rotation right after the internal medicine, and I really enjoyed that. It was in Israel they split it sometimes different depending on the hospital. They sometimes split it into surgical ER and medicine ER, and so you spend a little bit of time in each one. The surgical ER is a little more exciting. It's some traumas, a lot of hernias, a lot of abdominal pain, which could be something serious, so they send us to the surgical side, as it may require immediate surgery. But it was cool. I got to put in a lot of IVs and draw blood and help out with different procedures like Foley catheters and NG tube, nasogastric tubes. Actually, one of the surgeons taught me how to suture, and I got to stitch up some head wounds while I was there. So that's pretty exciting. And now I'm in surgery, as you can see. This is our surgical rotation. It's 2 months. It's going to go by really quickly. Thus far, we have only been in a couple surgeries. I scrubbed into a mastectomy on Thursday, and it was really, really interesting. When you scrub in, you're right there. You're viewing the whole procedure, and you're helping out. I was first. You helped out with retracting the skin, and so the surgical site is accessible by the doctors, but then I got to do a couple more things, ligation of different things, and finally towards the end, since I'm pretty good at suturing, I've done it before, the doctor let me suture the wound, and it was a really neat suture. It's a little different than the one we learned, but I picked it up quickly, and I've got some video, albeit poor quality video, but I've got some video showing me doing that and some pictures during the surgery. So far surgery's been a lot of fun. It's very exciting. It's new and exciting, so we'll see. There's a lot to learn, so I'm trying to get on top of that as we speak. Other than that, in between my internal and ER rotation, Yael and I went up north for the weekend. It was beautiful weather and a beautiful place, what's called a Mongolian tent. It's basically a cabin, but in the shape of a tent. It's really neat. There's some pictures posted below for you to see. And that was great to finally be able to spend some time with Ayelet and, finally not study. And then Ima, my mom, and Yonatan came, and Ayelet and I got to spend some time with them for about a week and a half, and we just kind of hung around the city and went to the beach and had some dinners, movies, hung out, things like that. Went away for the weekend to the Dead Sea and some hiking and waterfalls, and visited some some friends, some of my mother's old friends in around Jerusalem, and let's see. I guess that's about it. Just busy as usual. The life of a medical student is very busy. The weather's starting to get really cold here, and that's about it. I hope you guys are doing good, and look forward to seeing or talking to anyone I can when I get the chance to. See you later.